Good afternoon, and thank you for joining us this afternoon for this very important webinar. My name is Yvonne Lewis. I'm the co-director of the Health Flint Research Coordinating Center, outreach director for the Genesee Health Plan, and on behalf of the Healthy Flint Research Coordinating Center and our partners, we again welcome you to participating in this webinar. For those of you that are not familiar, the HFRCC is a multi-institutional partnership led by a strong community core, with our academic cores being University of Michigan Flint, University of Michigan Ann Arbor, as well as Michigan State University. We recognize that these are some very challenging times for our nation and for our community. So our goal today is to provide an opportunity for us to hear from our community members, as well as provide some insights on some what major things are happening that will affect us in our community, and resources that are available to us and will be available to us on an ongoing basis. Our goal today for this webinar, again, is to give community a chance to raise questions and to provide information. We will have multiple organizations, and we have state representatives, we have community agencies and organizations, service providers that will join us to share information again with you today to the best of our ability. So we want to just give you a quick overview of what our session will be like for the next 45 minutes or so, and which will give you an opportunity. So our agenda for today, we will have three wonderful speakers that will give you some insights. She's not some wonderful speakers that will give you some insights today. We'll have what science says for us about the public health perspectives, what science tells us from the medical and clinical perspective, as well as a little touch about what we'll do for managing our wellness. I think that's a very, very important thing for us to recognize. In addition to that, we'll have several community agencies share with you some responses that are already in place around this issue. We'll then open the phones for open dialogue and questions, and then a wrap-up session. I really want to say thank you to all of you that pre-registered and sent us questions. So we'll begin with the questions that were sent during registration, and then we may have a few moments to answer some of the questions that will come in during the webinar. As you are listening to the presentations, you may have a question that you thought about, or some of you that didn't have an opportunity to submit a question during the registration time, and you hear something that you may want to have addressed. Look at the bottom of your screen and you'll see there a Q&A. Please feel free to type in your questions, and we will be reviewing those as the webinar goes forward and provide you some answers as best we can. In addition to that, we're going to also tell you about some wonderful things that will be coming up. So again, for those of you that did not have an opportunity, please be sure you use that Q&A component to send your questions in so we can respond to them. Again, we have the three wonderful speakers. Dr. Deborah Holden, who is the Associate Dean of Public Health Integration Director and C.S. Martin Dow Professor of Public Health Division of Michigan State University College of Human Medicine. Also, Dr. Susan Wolford, who's Associate Professor of the Susan B. Meister Child Health Evaluation and Research Center, Department of Pediatrics Faculty, Community Engaged Program at MISHAR, the Michigan Institute for Clinical and Health Research, as well as a co-director for the Healthy Flint Research Coordinating Center at the University of Michigan. Our last speaker for this first component will be Dr. Jennifer Johnson, who is also C.S. Mott Endowed Professor of Public Health, a professor of OBGYN, a professor of psychiatry and behavioral medicine in the Division of Public Health, the College of Human Medicine right here in Flint. So we're going to begin this morning hearing first from Dr. Deborah Holden, and she is also one of the co-directors of the Healthy Flint Research Coordinating Center for Michigan State University. Dr. Deborah.
Great, thank you, Yvonne, and thank you everybody for joining. I want to just give kind of a broad public health perspective on where we are. So what are some of the predictable trends? This is a question that a lot of people have raised. I think the thing that's important here, and I put up this map of what it looked like in one part of China. The thing that I think is most important is what is mostly going to impact both the progression and the slope of what we see in our communities. There will be a direct link between the time that we intervene, i.e. that we implement and actually adhere to the public health recommendations that have been put forward, and the progression of disease. What we do is going to be, and how we do it is going to be the sort of rate determining factor for what the trend looks like in our community. The point that I really want to drive home here is that every day of ineffective intervention equals more cases. And I'll talk in just a sec about what that means for our community. So what are the public health strategies that we've been advised to implement to slow down the spread of the virus? You've all heard a lot about social distancing. I'll tell you in just a second a little bit more about that. And the point that I want to drive home here for people is not to be a vector. And I'm going to tell you what I mean by that. Basic strategies around regular hand washing, covering your mouth and nose when coughing and when sneezing, avoid touching your face, and cleaning high-touch surface areas often and regularly. So what is social distancing? It's deliberately increasing the physical space between people to avoid spreading the illness. The recommendation is that you stay at least 6 feet away from other people, and that will lessen your chance of contracting the virus. Also, we are being advised to stay indoors and stay at home as much as possible, and to practice distance and smart strategies when out of the house. So for example, several grocery stores now have created specified time periods early in the morning for seniors to come. That's because the stores are cleaned at night. There's less likelihood that people will have touched those surfaces. So I recommend that people stay abreast of what those things are that are happening and implement smart strategies when you do have to be outside of the house. So we've said don't be a vector. I want to clarify what I mean by that. Typically, when we talk about being a vector, what we mean is a carrier that can transfer an infective agent from one host to another. And an example that I think we're all familiar with is mosquitoes as vectors. So there's 2 different examples here. One, the mosquito has picked up something from fecal matter. The mosquito then landed on somebody's food, and the person then ate the contaminated food and they got sick. Similarly, a mosquito can bite an infected person and then bite another human being and spread the disease that way. But with this virus and with other viruses, we also have the opportunity for human beings to be vectors. And what I mean by that is you could actually be out, you could touch something that's been contaminated, or you've been exposed yourself in the world. You then come home and you can actually spread the virus, even if you're asymptomatic, to a vulnerable person in your home. They are now infected and they never left the house. So when we say don't be a vector, we mean minimize the transmission to people who are adhering to the safety precautions that we've put in place, because when you're out in the world, you do run the risk of being contaminated and serving as a vector for other people. You've heard some about flattening the curve. I want to tell you what that means. Flattening the curve refers to using protective measures to slow the rate of infection so that our hospitals and our healthcare system have the room and the capacity to meet the need. If we don't slow down the curve, what this shows us is that the number of cases that will happen if we get too many cases at once is it will exceed the capacity of our healthcare system. And you can see from the green curve, if we implement protective measures, we can flatten that curve out and not have the needs and the demands on our healthcare system exceed what we can actually provide. Why these strategies are critical? The best way we have to slow down the spread is to flatten those curves and implement those strategies. If we overburden our healthcare system, providers are going to be faced with very tough choices. I use the example, I have a 12-year-old cousin with asthma, and I have a 65-year-old uncle with COPD who's on oxygen. I would hate for a medical provider to have to make a decision about who gets the ventilator, my 12-year-old cousin or my 65-year-old uncle. But morbidity and mortality will be much higher if we don't flatten the curve and we overburden our healthcare system. We need time for intervention to take place. Dr. Wolford and others will talk a little bit about vaccine development and testing strategies, et cetera, but we need time for those things to be implemented. I'm also encouraging people, and these are the national recommendations, this is not an I'm good problem. You have to, again, think community and population, because even if you are practicing good habits, but you're moving about in the world, you could actually be an asymptomatic carrier. And I'm underscoring the point again, it's important to not be a vector. So practical strategies for community residents and for community leaders is to model good behavior, practice social distancing, Move to modified operations where possible. That includes supporting telecommuting and remote working. And those things should be unbiased. It should be irrelevant whether or not telecommuters have children or elderly or loved ones at home to take care of. We need to minimize large meetings. That means rescheduling or canceling things, or managing information exchange and decision-making via email, programs like Microsoft Teams, hosting large Zooms or webinars, etc., instead of having in-person meetings. And then to stay abreast of communications and credible information and disseminate to your communities of interest and other stakeholders. And the last thing that I think is the most important is we have to be proactive. This is the thing that we want to get out in front of and not wait until we're in full-blown crisis. Again, every day of inactivity equals more cases.
Thank you. Dr. Woolford will be up next to share with us the medical and clinical perspective. Can't hear. She can't be.
She's not muted.
I am now unmuted. Can you hear me? So thank you so much for this opportunity to share from the clinical perspective. And I do want to point out that things are changing rapidly. So some of the things I say today, we may know more about it, hopefully next week or the week after. But I thought we'd start out by talking about what is a virus. And a virus is a tiny infectious particle that cannot live outside of another host. It just has a genetic material in the middle, and then this fatty layer around the outside that keeps everything together. Coronaviruses are a family of viruses, and we've known about them since the 1960s. But what's happened now is that we have a new one, so-called novel coronavirus, that has emerged. But coronaviruses get their name because of their appearance. Because they look like a crown, somewhat like the ring around the sun. When someone looked at it under the microscope, they thought they looked like that, and so that's why they're called coronaviruses in general. So how do viruses work? Well, if we think about our body, but more specifically our cells as factories, and imagine that that factory makes cars. But while it's going about its business making cars, in comes along a vector, a virus that hijacks the factory, stops it from making cars, and instead makes it make parts of itself. And that just does it so much that it destroys the cells, and then those parts make more of the virus. In this case, we're talking about coronavirus doing that, and what it does is it is particularly good at destroying the work of the cells in our lungs, which is why we see so much of the respiratory symptoms with this particular virus. So how do we get it? Well, an infected person coughs or sneezes, and then those large respiratory droplets stay in the air for about 3 hours, and then some unsuspecting person breathes it in. And the distance that those respiratory droplets travel when one sneezes is just less than the 6 feet, which is why we want people to stay at that distance of more than 6 feet. Now, I mentioned that when it's the respiratory droplets in the air last about 3 hours, but you can see that on other surfaces, it can last up to 2 to 3 days. So if you touch those surfaces and then touch your eyes, nose, or mouth, you can infect yourself that way. So how many others will a sick person infect? And that's called the RO for short. And we know for influenza that each person who has influenza, on average, infects another 2 to 3 people. We don't know really what it is yet for this virus, but we think that it's somewhere between 1 and 4 people. So say you got exposed and you're infected, how long does it take for symptoms to develop? Based on our experience with other coronaviruses, we think it's about 1 to 14 days, on an average about 5 to 6 days, although there have been some case reports up to 24 days. I'm going to show you some information about the first patient who was diagnosed in the US with COVID-19, and this was published in JAMA. And if we look at it in days from the time they returned from their travel, so the first few days they felt well enough to go to work. The next day they stayed home because they weren't feeling too well. Then they sought medical care. You'll see they started out with a cough and then developed these other symptoms that are common with COVID-19. And COVID-19 is the name for the illness caused by the novel coronavirus. So fever, fatigue, cough, and difficulty breathing are hallmarks of COVID-19, but we also see the other symptoms listed there. It's important to note that there is no currently FDA-approved treatment for COVID-19, but there are some promising ideas, and so we have some hope. Chloroquine, which has been used for malaria, along with possibly some other antibiotic, might work, and they're tests exploring that. Also, antivirals. We know Tamiflu, the one that we all typically get for flu, doesn't work here, but others are being investigated. Convalescent plasma. So if somebody has had COVID-19 and recovers, getting their plasma and getting the immune globulins from them and giving it to a sick person might help. And then, of course, as mentioned, vaccines are under development, but that will be further down the road. So what we can do at this point really is to manage the symptoms. So that's giving people fluids, managing pain and fever, and giving oxygen. And as was mentioned earlier, this is why we really don't want to overwhelm the system, because if we have too many people that need ventilators at the same time, we might outstrip the capabilities of the healthcare system. So it really is down to what we can each do. Social distancing really makes a difference. We are our brother's keeper. We can help to break that chain. Hand washing, as was mentioned, and we will maybe talk more about the science of hand washing in an upcoming, in a future webinar. We want to stop touching our face, particularly mouth, nose, eyes, avoid touching those mucous membranes, and do what we can to keep our immunity strong. And now with that, I'll hand over to Dr. Jennifer Johnson for the next presentation.
Thank you, Dr. Wolford. Dr. Johnson?
Yes, fantastic. So it's really interesting. I'm going to show you in a minute, but the things that were just on the slide to boost your immunity are also things that will reduce your stress. So there's a double benefit there. All right. So, you know, everyone reacts differently to stressful situations. And I think the thing that's important to recognize is that it's okay if you are reacting differently from your friends or other people in your house and they're reacting differently from you. It's all right. Signs of stress in adults, like I said, can include fear and worry. One of the things I've seen recently is anger, people being angry at others that they perceive as putting them in danger, difficulty sleeping, changes in eating patterns, increased use of substances. And in children and teens, sometimes, you know, they're less able to articulate what they're feeling. So they may be really grouchy, they may cry, they may start doing things they've outgrown, like wetting the bed again, or develop physical symptoms. So just, you know, be alert to the signs of stress in yourself and the people around you. So for adults, like I said, this is almost exactly like Dr. Wolford's list. So these are double benefits to reducing your stress and boosting your immune system. Exercising is great stress relief. The gyms are closed, but a lot of people have put free workout videos online that you could do at your house without equipment. Or if you live in a place that doesn't have a lot of people or can get to a place without people, walking outside, the weather is nice now. As much as you can, keeping to a schedule, you know, go to bed at a particular time, wake up at a particular time, work at a particular time, reach out to your loved ones, you know, phone, Zoom, FaceTime. Fortunately, we have a lot of great ways to do that now. Take news breaks and social media breaks. Don't spend all day, you know, watching coverage. Anything to take care of your body, despite the fact that stress can increase people's desire to use substances, minimize substance use, get sleep, eat your fruits and vegetables, and take time to do things you enjoy. They'll just help you be more resilient to deal with the stressful moments. And then for children and teens, take time to explicitly talk to them about it. Tell them the facts about what you know, answer their questions, but reassure them that they're safe. It's okay to feel upset, it's okay to be stressed out, but, let them know the facts, because especially children and young teens may hear something and understand it a completely different way than is the truth. So have explicit discussions. In terms of limiting your family's exposure to news and social media, again, this might be especially harsh for a teen, so you don't have to cut them off entirely, but if you notice your child or your teen is just glued to the news all day, you might suggest that they do something else. Create a schedule and a routine. Again, it's going to be different if they're out of school, but lots of sleep, learning, good food, exercise, and you can be a role model for self-care. Show them how that looks and help them connect, via phone, FaceTime, etc., with their friends and family. And I will turn it back to Yvonne Lewis.
Thank you. I want to appreciate Dr. Johnson, Dr. Wolford, and Dr. Deborah Verholden for giving us those facts, and again, and a little uplift at this last presentation. And one of the things we did was we asked some really important leaders to come and talk to us. Now, we recognize that every one of you on the phone are so important. So again, we appreciate you for sharing your questions earlier. A couple of things we want to just say right now is that the webinar is being taped, so you'll have an opportunity to view the tape, and you will also have an opportunity to have access to the slides that were presented earlier. So we want to be sure that you have that information. Now, we're asking each of our presenters to take a couple of minutes and talk to us about some of the things that their area is doing that will help us to understand how we can address the issues right now. So first of all, we want to hear from John McKellar, who is the health officer of the Genesee County Health Department.
So this is Suzanne Kupel. John is not able to be on the call, but I am ready to answer questions for you. I do want to let you know that as of this moment, Genesee County now has 4 presumptive positive COVID-19 cases. The cases are a 35-year-old female, a 15-year-old female, a 22-year-old female, and a 54-year-old male. We have information on 3 of the 4 individuals that they are recovering at home and doing well. The messaging that Deborah shared with everyone earlier is what we are continuing to share in the community. We ask for your assistance in continuing to share that information with others, to practice social distancing, wash your hands, cover your cough, wash surfaces on a regular basis. At this time, there is expansion of testing in doctor's offices and urgent cares. That is happening as we speak. We do not yet have any community-wide testing scheduled, but that is something that is in the works. If anyone has any questions, I'd be happy to share additional information. But I do want to let you know that the Genesee County Health Department has a call center. So if people do have questions, they can call and get information or be referred to other resources. That number is 810-424-4443.
Thank you, Suzanne. And what we will do is each of the presenters will have opportunity to share their wonderful tips. And then following all of the presentations, we will then have open opportunity to respond to some of the questions that we're receiving. So if you have questions, please be sure you click that Q&A button and help us to know what those questions are. Our next presenter, Dr. Lawrence Reynolds, is the new Chief Advisor for the City of Flint. Chief Health Advisor for the City of Flint.
Well, good afternoon. I'm not exactly the chief, but I will be the health advisor. What I'm glad to share with you is that there have been no new water shutoffs in the city of Flint since October. And since this week, the city is engaged in receiving calls from people whose water has been shut off prior to October so that we can restore water service during this pandemic. The mayor recognizes that we can't tell people to practice good hand hygiene and clean their eating utensils, clothes, and bedding if they have no water. So this has been very encouraging. He did not equivocate on that point at all. So we still ask everybody, pay your water bill if you can pay your water bill. But during this emergency, water service can be restored in a residence if it is occupied by the person who makes the call. We do not want to turn on water in unoccupied residences. We will continue to work with our county health department and our state health department. As many of the speakers have said earlier, what we say today may change based as early as this evening or Monday, based on what we hear and what we see and what we find out about this new novel coronavirus. So contrary to what you may hear in the news, this is not something that's guaranteed to go away like seasonal influenza. We may have to work with this for months until we get a better idea as to how this virus behaves. So all the advice that has been given previously about social distancing, good hand hygiene, avoiding unnecessary outings, avoiding crowds is essential so that we can flatten the curve. And remember, testing is not a substitute for these things. Testing lets us know if a symptomatic person has coronavirus, and this is after we've tested for the seasonal influenzas. Testing is a surveillance method, and should hospitalization be necessary, it guides treatment. So remember, always call your physician first, and then follow those instructions.
Thank you so much, Dr. Reynolds. Full of great information. And as he said, things are constantly changing. And so it's important for us, as part of the work of the Health Flint Research Coordinating Center, is to be on the front end of helping get this information out. So we, again, thank you for those of you that joined us. If you did not hear the announcement earlier, please go to that Q&A button on your screen and ask your questions through the Q&A. Microphones will be open to those who are here to present to you today. The Michigan Public Health Institute, Dr. Renee Kennedy, and before she comes, I do want to acknowledge that the Michigan Department of Health and Human Services is very interested in what we're doing here in the city and open to hearing comments from our community. So they too have joined us on the call today from the Office of Equity and Minority Health. So we appreciate them for being on today. Dr. Kennedy, can you tell us, as the Chief Executive Officer, what your insights are with respect to the work of the Michigan Public Health Institute?
Yes, thank you. Thank you for also acknowledging our colleagues at the Michigan Department of Health and Human Services who are really leading the charge, if I can say it that way. When there is a public health event, a communicable event, the statutory responsibility lies with our governmental public health entities. So our county or our city health department, our state health department, our federal leaders, but that is always a coordinated response with both the community and the private sector. And so we wanted to help you understand a little bit about how many players are a part of that. The Michigan Public Health Institute was actually created by our state health department to help extend their reach into communities. So when there are unexpected events such as these, then they have a nonprofit resource to also be a partner and an ally in the response. For example, our state health department has activated what's known as a CHECK, which is our Community Health Emergency Coordination Center. That makes sure that they've got all of the information, all of the requests, all of the questions coming into a centralized location so that there is a unified response. So we're really fortunate in Michigan to have leadership that is informed, that has a number of resources. One of the things that I want the community to understand is that it is important for the community to articulate and advocate for their needs. So they are informing the response that the health department and other public health professionals develop. We don't want to develop and implement something that really is not going to be a good response or a good fit in particular communities. So we get information from the feds, we filter it through the state, it goes down into cities and counties, but this is not one size fits all. We have some fundamental practices that we're implementing, but we also want to be responsive to the needs of community. And certainly our hope is that our response to this epidemic, this pandemic, will strengthen relationships and help us see where resources need to be strengthened so we will be better together post-coronavirus.
Thank you, Dr. Kennedy. That gives us a good sense of what's happening. So we've heard from our county, we've heard from the state, and we've heard from our city. And now we want to hear from some of the county-based organizations that are working right in the trenches with us. So we have a lot of questions about the schools have been raised. So the Genesee Intermediate School District will be represented this afternoon by Tricia Hill, who's the Executive Director of Community-Wide Programs. Tricia, please share with us.
Thank you so much. Good afternoon. I just want to share a few things that are happening here in the Genesee Intermediate School District. First, I'll talk about food distribution for students. The GISD does have sites throughout our special education center-based programs and our early childhood sites. And also our local districts and our charter schools have truly stepped up. They're doing amazing jobs at distributing food. We do have a map of all food distribution sites for students on our website that we are updating daily. Our website is geneseeisd.org. If you would like to access that map. An important thing to know is students can access any site that's distributing food. It does not have to be the school they attend, and students do not necessarily need to be present. If a parent needs to go to the site to get the food for the child, then that's absolutely approvable. We just want to make sure kids are able to get 2 meals a day at those sites. We are also providing grade level educational work packets at those food distribution sites starting today. Those will be available weekly. We will make sure they're at the GISD sites, and we are providing them to the local school districts and the charters if they would like to make those available as well, just to make sure we're keeping kids engaged. And then also, many of you have probably seen the governor's executive order on providing emergency childcare for our essential workers in our state. So the Genesee ISD and all ISDs across the state were asked to coordinate that effort. We're working very closely with Child Care Network, one of our partners, just making sure that we're providing essential workers with a spot. We have a lot of surveys out there on our website for the essential workers if they need care. We will refer them to the Child Care Network. Child Care Network will first use available spots in our private centers throughout the county. And if needed, the GISD will open some of our approved early childhood classrooms as an overflow for childcare for our essential workers in our county. So those are the 3 items that I wanted to share today.
Thank you so much, Tricia. And I want to just ask you again, if you could repeat that website. And while you're getting ready to do that, let me just say, all of our panelists will be seeing the questions. And so our panelists may respond to some of your questions directly because they're very clear and distinct answers that they can give. So we will also be capturing questions that are more broadly. So again, our panelists feel free to answer the questions that are relevant to your presentations. And so again, one more time, would you give us that website?
I sure will. Genesee, GeneseeISD.org. And there's a big coronavirus section, and you can find the food distribution sites right in that area.
Thank you. We will include a slide at the end that will show all of these sites in case anyone missed them, and when you review the webinar at a later time. Going from the GISD to the Flint Community Schools, excited to have Anita Stewart, who's the Deputy Superintendent of the Flint Community Schools. Anita, please.
Thank you so much, and I'm so honored to be able to join you guys on this afternoon.
We can barely hear you, Anita.
Can you unmute yourself, or?
Can you hear me now?
That's much better, Anita. Thank you.
All right. Good afternoon. Thank you for having me. I'm so honored to be here today on behalf of Flint Community Schools. So what I wanted to share with you, some of the things that we're doing in Flint Community Schools. We have a small scale of staff. We call them our wraparound service team. They have been making phone calls to our families, and we're doing student and family wellness checks just to check in with our families to see what their needs are, to make sure that all of the students are doing okay, they have all of their necessities. And if they do not, that's an opportunity for our families to lift what the needs are at that point in time so that Flint Community Schools can assist them in helping them to get whatever it is that they need. We also have 24 distribution sites around the city. We have a north zone, a central zone, which is in the middle of the city, and we have a south zone. Those zones can be found on our website at flintschools.org. And from 10 to 1, we are providing breakfast and lunch to all of the students that live within the city of Flint. The students do not have to be present. Parents can just pull up, and it's the grab and go breakfast and lunch. A staff member will hand them a bag with breakfast and lunch for the day. So far this week, from Monday through Thursday, we have been able to distribute 20,000 meals between the days of Monday and Thursday. We also have standards-based work packets that are also being provided at the sites starting Monday. Students will be able to, parents or students will be able to pick up a packet. It will have their name on the front of the packet, and they can pick up a packet at any of the sites. And so this week, our wellness team, they have been calling parents to see whether or not the parents would like to come to the school to pick up the work packet or go to one of the 24 sites. If they said that they wanted to go to one of the 24 sites, then their standards-based work packet will be available at one of the sites starting Monday. On our website, you will also find online resources, and that went up this past Tuesday, where parents could access online resources, an opportunity for our students to engage in some academic resources during the course of this week. Also, if a parent has elected not to go to the school or to go to one of the sites, as of Monday, our standards-based learning packets will also be available by grade level on our website, and parents will have the opportunity to access the website to get material for their child to work on for the week.
Thank you, Anita. It's so wonderful to see that our schools, the Flint Community Schools, as well as GISD, has been so responsive so quickly. So thank you for that. And we also want to now hear from the Genesee Health Plan, Jim Melanowski, who's the president and CEO. Jim, please.
Well, hi, Yvonne. Thank you. The Genesee Health Plan is closed to the public, but we have a full staff that's available by phone to assist people in our community. So I'm going to give you the number to call. So please have everybody call 810-232-7740. And we can help with the following things. Enrollment. There's a lot of people who might be losing their jobs right now or find themselves unemployed and they don't have health care coverage. We can assist them in signing up for the Genesee Health Plan. So we're going to do that by phone. We're going to take all their information over the phone, see if they qualify and meet our eligibility criteria, and then we can start their coverage. Normally, when they do it in person, they bring proof of income, proof of residency. We're going to waive all that for now until this all dies down and people can bring that to the office to verify. So it's going to be pretty easy for someone to sign up for the Genesee Health Plan. And also for those renewals. We have a lot of people who are at the end of March are up for renewal. We're just going to extend those till end of April, and we might have to keep extending those until, again, they're able to come in and show those proofs. Same thing with our dental coverage that we provide for seniors and veterans. We're extending anybody who has coverage that ends this month, and then we can also do new enrollment over the phone with them, and we'll catch up with the paperwork later. Right now in the state, I think they're only doing oral health services on an emergency basis, but people can still sign up and have this coverage ready to go for themselves. We get a lot of calls about Medicaid from Medicaid recipients, and we're just going to refer those to the beneficiary helpline or MyBridges. But we do have, Genesee Health Plan has an assigned MDHHS worker on site, or normally on site. They're not here, but we can get messages to them and emails, and we can have that person contact people who have questions or they're troubleshooting, they lost their coverage, they need some assistance. So we do have that resource available. I know one of the questions that came in, Yvonne, beforehand was about immigrants and people who've got, are in our community. We have a bilingual health navigator that will be available. So again, we have another navigator too to help with folks that have a language barrier or a cultural barrier that might prohibit them or have difficulty accessing health care. So they can call that person, they can help navigate to find out where they can go for help, and then also do some, especially if they're Hispanic, do some translation, medical translation over the phone. It's not ideal, but we can do that, and we can assist those folks where that language and culture are barriers. And then our team of community health workers that normally are out in the Flint Public Schools are available. They are great at locating local resources for folks, so they're available by phone. And then we also have a Veterans Health Navigator, veterans that need assistance in navigating where they can go for help with health care. Evan's his name, and he'll be able to help them with that as well. So I'll be glad to answer any questions later.
Thank you so much, Jim. And you said you'd be glad to answer any questions later. So I'm going to ask our panelists again. If you look on your screen, there's a place on there that you can see the questions. If there are questions, go to Q&A. You can see the questions. We want to put you to work right quick because we only have a few minutes left. But please go on there. If there are questions that you can specifically answer, please type answer and respond directly to those questions. Harmony is up next. Harmony Lloyd is the Director of Planning Innovation at the Mass Transit Authority, and I'm sure she has information that some may have already asked a question about. She will respond to that as she gives her presentation. So Harmony, please share with us.
Sure. Thank you so much, Yvonne, for having me. The big news, the overall news, is that all MTA services, including our fixed route buses, our Your Ride, and our Rides to Wellness services, are all operating with the usual hours and services. We are not cutting service, we are not ending it, and we have no intention to shut down service. We are considered an essential service, and we plan to continue operating, as we know we're a lifeline for many people to access resources. One of the key steps we've taken to help protect our drivers is we have suspended fare collection on our fixed route buses. So all 14 fixed routes throughout Flint and the surrounding areas are fare-free until at least April 6th, and we're asking passengers to enter through the rear door of the bus unless they have a disability and need the driver's assistance. And then once they're on the bus, we're asking people to practice social distancing to help ensure the safety of themselves and the other passengers. Our administrative office staff is working remotely, so the administration building is closed. However, everyone is available through their phone and email, and will continue to provide service as needed through the administration department. We're going through extensive cleaning processes that we've implemented to ensure that all surfaces in the facilities and the vehicles are happening daily and throughout our operating hours. We've added 15 employees to our custodian crew, and they are stationed at our transfer center downtown. They are cleaning and disinfecting the buses throughout the day as the buses come through the transfer center so that we can keep them clean. In addition, we've added additional buses to routes that are typically heavily traveled, so buses that are on some of our regional work routes and have high numbers of passengers. We're adding additional buses so that the passengers are able to spread out and practice social distancing. And then finally, we have partnered with G-Card because our ridership has slowed down. We have taken some of our drivers, and they are going to G-Card each day to assist G-Card in their Meals on Wheels delivery. And so that's been a really positive partnership that has helped G-Card be able to increase the number of meals they're delivering to homebound seniors, and to also keep our drivers working and out helping in the community. So that's all I have right now, and we will keep you updated through our website and our Facebook page as things change.
Thank you so much, Harmony. That is just amazing what's happening in our community. And so this is one of the things that was really important for us, is that we know what's happening. We hear a lot at the state level and at the federal level, but what's happening here locally that people can actually tangibly use right now. So again, I want to remind you that Q&A button is there for you to submit additional questions. There are a couple of things that we didn't have a representative on. So Kalfani Stevens is on the webinar, and there was a question about small business, opportunities for small businesses. So we're going to unmute your phone and ask you if you would give us some updates from the City of Flint's perspective on what can be done to help small businesses. Are you there, Kalfani Stevens? Okay. You are unmuted, so you can share with us now. Okay, well, we're going to move on. We have one other item that came up, and that is information about the Flint Registry. We know that the Flint Registry has been identified as a resource for our community. When people are enrolled in the registry, they'll be connected to some additional resources. So Afton Shavers, we're going to unmute you so that you can share something about the Flint Registry. Afton, are you there?
Good afternoon. Can you hear me?
Yes, ma'am.
Hello, everybody. So briefly, just a kind of synopsis of where we are with registry. We are still able to process surveys for people who choose to complete them with us. And we're really hoping that since folks are at home practicing their social distancing, this is a good opportunity to go ahead and submit those surveys for the registry. You can get those from our website if you have your survey code. And if you do not have your survey code, you can contact the registry offices at our regular number, which is 833-GO-FLINT. And one of our wonderful folks in the office can get that survey code for you. Survey codes have also been emailed out to anyone who is already in the system and has an active survey code that has not completed their survey. So that's also an opportunity. You can have your survey code emailed to you as well if you'd like to get it that way. And so the email would be Flint Registry .hc@msu.edu. And so you can get your survey code that way. From the outreach perspective, we are kind of in flux. We're going to be rolling out a new plan starting next week, where we're going to be doing some outreach electronically. We're going to be amping up our distribution of some of our newsletters, and we're going to try to also get some information to the community about those meal spots, and then also at those meal spots share some information about opportunities to connect with the registry that way. So that is kind of where we are at the moment. If you have any additional questions for me, you can email me at outreach@flint.org.
Okay, thank you. Outreach@flint.org. We're going to try to make sure we get that up on the screen as well at the end of the webinar. We only have a few minutes left. There's some really big questions that have come forward. We want to ask our panelists. One of those questions, Dr. Wolford, during your presentation, you talked about symptoms. And so someone asked, so symptoms are more than fever, because a lot of times that's what we've been, if you got a fever, then you need to check it out. So can you just reiterate what you said about symptoms, Dr. Wolford?
Absolutely. So yes, it's more than fever. Generally, it's a cough and fever. And then when we're thinking about it becoming severe, what we often see then is difficulty in breathing, shortness of breath. There are a number of other things that have been noted, diarrhea and vomiting, abdominal pain, but the things that are typically seen are fever and cough, and then, as I say, as it worsens, the difficulty in breathing.
Dr. Wolford, while you're right there, one other thing, if you could touch on for us, what we're hearing is that many people with the virus, and Dr. Verholden mentioned this, that they're vectors. They have the virus, but they have no symptoms. Can you just speak to that again, either Dr. Wolford or Dr. Verholden?
So yes, you could have the virus and not have symptoms. And the concern is that if you have mild symptoms and no symptoms, but you're still contagious, then you can be, and I'll let Dr. Deborah speak about that, but the vector that she spoke about, spreading it. So that's why we have to be very concerned.
Dr. Wolford, another question that just came in. Can't the virus survive on surfaces?
Yes, so if you remember one of those slides I showed, it talked about the length of time that it can survive on different surfaces. And on some surfaces, and it depends on the temperature and the humidity that makes the time vary, but it can last up to 2 to 3 days. So that is why when you leave your home and you touch something, think about and remember to wash your hands, clean them with hand sanitizer, because you don't have to be the person who caused the infection there or who left the respiratory droplets there. It doesn't have to be there, but that virus could still be there.
Okay, thank you, Dr. Wolford. We do, Kafani Stevens had a little bit difficulty with the microphone, so we're giving a website out if you have questions about small businesses. This is a real concern, so if you have questions about small business, you can go to www.michigan, spelled out, business, spelled out, all together, michiganbusiness.org, /COVID-19 /. We're going to put that up as well, so that you'll see that, but there is a website for those small businesses to go to learn more about how they can get some assistance and protect their small businesses. Dr. Reynolds, I hope you will open up your mic. We have a couple questions for you from the city, and we've only got a couple minutes left. This is exciting, but time is running out. Dr. Reynolds, what is the city of Flint doing to mitigate the spread of the virus?
As I said, we are restoring water service and making sure it's safe and maintaining water service. You should understand that the way public health is organized in the state of Michigan, the county health department exists to serve the city. So my role is to make sure there's good communication between the county health department, the state department, and the city of Flint. So when residents let us know of a concern, we can make sure we can find an answer and work for a solution.
Now, Dr. Reynolds, while we're talking about things from the city, we have already heard that our GISD and the Flint schools are talking about food distribution for children. But another question is, how will the city help manage resources should we, in fact, go to full quarantine?
That's one of those questions where, being in a pandemic, we must work with the Genesee County Emergency Operations Center, our county health department, and the State Department of Health and Human Services. The city alone does not have the resources or the capacity to deal with those things alone. So we will be in close concert with those other agencies.
Thank you, Dr. Reynolds. I want to go back when we talk about the coordinating resources. Suzanne Kupel from the Health Department, you gave us a number for the hotline. Would you repeat that hotline number for people to call? Suzanne Kupel, are you there? Okay, I asked a question and I wrote the answer down, so I will give that number, but we'll look to put it up as well. Maybe she had to leave us. 810-424-4443 if you have questions, particularly about testing and other things that the county health department is responsible for. Please call 810-424-4443. We have another question, Dr. Wolford. If you have mild symptoms and take cold fever medicine, can the virus continue to grow or worsen?
So if you have the virus and you take cold medication, it won't kill the virus. We don't have anything that will actually treat the virus at this time. But many people, and I think Dr. Reynolds said this, the first thing you should do if you have questions is consult your doctor. They may advise you to take medication to deal with the cough or the fever, and that's just to help those symptoms while your body fights off the infection. And I just want to say again, the main symptoms being cough and fever, and then some gastrointestinal ones have been noted, such as diarrhea and stomach pain.
Thank you, Dr. Wolford. This last question to Dr. Jennifer Johnson, because you wrapped up the panelists speaking about managing stress. One of the questions that came is Flint feels, some of the residents feel that we're in a really unique situation because it's crises on top of crisis. Moved from water crisis to now, here we are with this COVID virus. How does the community, how can you help us again talk about some coping mechanisms before we leave this call today? There's a couple of really important tips you'd like to leave with us. Dr. Jennifer Johnson?
Yeah, can you hear me now?
Yes, we can.
Yeah, so I mean, the first I think is to recognize that it really has been a rough few years, if not a rough couple decades for Flint. I mean, and chronic stress takes a toll. And so, you know, I think the first is just acknowledging it and saying, you know, yes, this has been really stressful and continues to be really stressful. You know, to the extent that you have people that care about you and you care about them, you know, reach out to them. If they offer to help, don't brush it away. And, you know, if you can, I think people in Flint actually do a great job of coping by helping others. That can help. But then, like I said, be really mindful of your own sleep, mindful of your own exercise. You know, for me, it's a bit of a blessing that it's not 20 below outside anymore, you know, to go for walks in the woods or something. You know, don't overuse substances and stay on a regular schedule and try to take care of the people you love, you know, and understanding that, yeah, chronic stress takes a toll, but everything you can do that makes your heart happy and your body stronger will help you.
Thank you, Dr. Johnson.
Deal with the chronic stress.
I know you have so much more to say, but our time is really just about out. We have 1 minute. I want to thank all of you. We had over 150 people on the webinar today. I want to thank each one of you for joining us and spending this time. We want you to know that there will be an upcoming session. Please join us. We did not get through everything today. We will try to respond, but join us next Friday at noon again. We will send out additional information for you, and please encourage others to join us so that we can continue these conversations. We'll do our best to respond to the questions that we were given and make sure that you have access to this webinar today. Let me again, on behalf of the Healthy Flint Research Coordinating Center and all of our partners, thank you again for joining us, and let's do what we can to be well, be healthy during this time.